This recording is, or I'm sorry, this training is going to be recorded and will be available on the OCHN website for future reference, probably within the next week. Tracy, if I'm missing anything else, please feel free to jump in. But with that, I will turn it over to you.
All right, thanks, Sally, and thanks to everyone that is attending. And I've done similar presentations for OCHN over the last several years, and always excited to be asked back again to share more information and resources and helping folks connect with the information they need in order to make informed decisions about how benefits and work go together for yourselves or people that you work with or your loved ones. It's important information, and we're lucky here in Michigan to have the support of the Michigan Disability Benefits 101 site. That's a wealth of information. So as I go through information tonight, I'm also going to include links and references to where specific information is on the Michigan Disability Benefits 101 site, because it is a lot of information and trying to understand and comprehend all this, but there is resources out there to help you look into what we're going to cover tonight in more depth, and where you can get additional help as well too. So a little background on myself. Again, my name is Tracy Howard, and I currently work as the Benefit to Work Coach State Lead, which is an initiative through MDHHS and the Behavioral and Physical Health and Aging Services Division of MDHHS, to basically within our community mental health systems, primarily focusing because of our funding source on individuals experiencing a mental illness, on filling in some of the gaps in getting people the information they need to understand how benefits and work go together, and to promote employment, basically. The fear of loss of benefits is so often a barrier for individuals in choosing to work, that we're proactively trying to provide lots of information and education and resources to help folks overcome the myths that are out there and understand that the reality of, regardless of whether an individual is receiving a SSDI benefit and or an SSI benefit, that they can work, they can get ahead financially, they can keep their cash benefit or access to their cash benefit, and they can keep their health insurance. And that may sound a little different than what you may have heard previously, because there is, again, unfortunately, so much misinformation out there about benefits and work. But I'm going to say that repeatedly, and I'm going to provide you with information that supports that individuals who are receiving a Social Security disability benefit can work, get ahead financially, keep their cash benefit or keep access to their cash benefit, and keep their health insurance benefit. At any time you have a question as you're going through this, feel free to pop that in the chat. Sally's going to help me with monitoring that. If it's a question that I know that we're going to cover in further on in the slides, I might table it for a minute, but Sally will keep me honest and make sure that I get back to it when we cover that information. So this is your opportunity to ask questions and get clarification of understanding of things. So don't be shy in asking those questions. The PowerPoint was also sent out this morning with everything that I'm going to cover. And on the last slide of that PowerPoint is my contact information. So if there's ever anything that I can do to help you get connected with resources you need to make informed decisions about benefits and work, please feel free to reach out to me, and I'm happy to help point you in the right direction. Additionally, background on myself, I started out, about 14 years ago working for Training and Treatment Innovations and doing exclusively benefits related work, either helping folks get connected to benefits, helping my coworkers and colleagues understand how to navigate these systems, and then turned into helping people understand how benefits and work go together. I'm a certified benefit planner through both Cornell University and Virginia Commonwealth University. And like I said, I lead the Benefit to Work Coach Initiative here in Michigan to kind of bridge some of the gaps in the system. So I live and breathe this stuff, and for whatever reason, my brain enjoys to know all these rules. And the part that I really enjoy is helping other people connect to this really complex stuff and trying to break it down into an understandable, reasonable avenue so that folks can understand and not feel like they're kind of walking blindly through this. So really trying to, it feels sometimes like I'm an interpreter, helping folks connect with this information. And I enjoy that aspect as well too, because ultimately you see the benefit pay out when individuals understand it and are really able to make an informed, empowered choice about how they want to navigate their employment lives and their benefit lives. It makes a huge difference. So I really enjoy this work. But the other thing is to keep you at ease a little bit. The expectation of our 2 hours together is not that all of you are going to become experts in all of this. It's going to take a lot more training in 2 hours, but goal today is to give you kind of high level overview of some of the work incentive concepts, some resources to be able to dig in deeper and get additional information, and then where folks can go for individualized assistance with navigating their own questions and concerns. So what we're going to start out with is just kind of connecting with a little bit more about with the reason in regards to this work. So the Social Security disability benefits have work incentives that make it possible for individuals who are receiving these benefits to be able to go to work, to test out working, to and be able to maintain access to those benefits. So regardless, again, of whether somebody's receiving SSI and or SSDI, they're able to maintain their health insurance benefit. They're able to get ahead financially and either choose to keep their Social Security cash benefit or stay connected to that and not have to go through the process of reapplying all over again. They're able to, in that, have extra funds to not only pay for work-related expenses, but other financial goals and expenses that they reach. And this, if you think about the goal of employment and what employment does for an individual's life, it's not about just getting a job. And it's not about just getting ahead financially. That's, part of it. But work provides so many benefits to an individual's life. It can provide, a sense of routine, of structure, of feeling empowered, feeling like you're learning new skills or applying the skills that you have. We don't work in isolation either. We work with coworkers and colleagues, so we develop, social and professional relationships as well too. It starts to bring about a sense of competency. It allows people to have kind of a sense of freedom and more autonomy than they may have experienced before. And these work incentives that we're going to cover tonight is an avenue that individuals can use to get connected to experiencing those benefits of employment, which can be so powerful in an individual's recovery process. So that's kind of the point of it. We're going to talk about the details, but ultimately the point is getting folks connected to those wonderful benefits of employment. So what we're going to go through is we're going to go through the basic Social Security disability insurance, or SSDI, and the Medicare health insurance work incentives. Then we're going to talk about freedom to work Medicaid, because that can go along with the SSDI benefit. Then we're going to jump down into SSI and Medicaid, the basic work incentives for those. Also going to talk about ABLE accounts, which are achieving a better life experience account, because a lot of times when individuals start working with that SSI benefit, they need to have another avenue to be able to save money that's not going to adversely affect their SSI benefits. So we're going to talk about that. And then we're going to end with where individuals can access additional help and resources. Any questions so far, Sally?
None in the chat. I forgot to mention earlier, there is a raise hand function at the top of the screen, and it just says raise. So if you do have a question throughout the presentation, you can use that function as well.
All right, so let's jump into SSDI and Medicare. So SSDI stands for Social Security Disability Insurance. And and I try to stress the insurance part because this is an insurance benefit. In SSI, which we're going to talk about in a little bit, is supplemental security income, and that's the financial needs-based benefit. I go through this right now because a lot of folks use the terms SSI and SSDI interchangeably, and don't understand the difference between those. But SSDI is an insurance benefit. It's a cash benefit that's based off of an individual's own work record. So you worked enough, you paid enough of those taxes on your earnings to reach disability insured status. So you worked and you earned this benefit, okay? This is not a financial needs-based benefit. There is not a criteria of a limit of assets for this benefit. It's based off of working enough, paying enough taxes into the system to reach that insured status, and then meeting the Social Security definition of disability. So I always kind of liken it to any other insurance benefit. So in order to have an insurance benefit, you have to do something to get that insurance benefit. So like your car insurance benefit, in order to have car insurance, you have to pay your car insurance premium, and it's just sitting there waiting for you, and hopefully you never have to use it. But if you get into a fender bender and you need your car repaired, then you're accessing that insurance benefit because you've paid for it. SSDI is the same way. You've paid for it through your taxes from employment. And then if you become disabled and meet the Social Security definition of disability, you're accessing that insurance benefit. Okay. The amount that an individual can receive in the SSDI benefit is based off of their own work record. So it does vary pretty drastically between individuals because of it being based off of the amount of taxes you've paid on your earnings. So somebody who earned, maybe $10,000 for a number of years is going to be entitled to a lesser amount in the SSDI benefit than somebody who earned $70,000 for a number of years because the taxes that were paid on those earnings were quite different. Across everybody who's receiving it this year, the average is that $1,364 a month, just to kind of give you a ballpark. But it can range from pretty much anywhere in there on that. The other thing that helps to differentiate between the SSDI and the SSI benefit is the day of the month that these benefits are paid on. So the SSDI benefit is generally paid on the 3rd of the month, where the SSI benefit is paid on the 1st of the month. So SSI is always paid on the 1st of the month. SSDI is generally the 3rd. It could be a different day, but never the 1st. So if folks aren't sure what benefit they're receiving, they usually know what day of the month that deposit hits their bank account or their debit card. So it's just another way to help you differentiate between the SSI and SSDI benefit. And then Medicare comes with the SSDI benefit automatically after the 24-month Medicare waiting period or Medicare qualifying period. And that 24-month clock starts ticking from what Social Security calls the date of entitlement. And that's the date that that a person was eligible for their payments to begin. So it's not necessarily the date that they were approved, but it's the date that they were back paid to. Okay. So a lot of times by the time a person is actually approved for the SSDI benefit, they've served a portion or a good portion of that Medicare waiting period. And then that last bullet point is just that there is no asset limit for this benefit, okay? Because it's an earned benefit, the amount of money you have in the bank, it doesn't matter. If your car insurance, if you went to make that car insurance claim and they said, we're not going to pay your claim because you've got $10,000 in a 401k, you're going to be angry, rightfully so. It's the same with this. It doesn't matter how much money you have in the bank, okay? Because you worked for it and you earned it. I also wanted to cover another disability insurance benefit called the Childhood Disability Benefit, or CDB for short. This used to be called the Disabled Adult Child, or DAC benefit. But I wanted to cover this one in this presentation because I have oftentimes more family members come to this. So this is also an insurance benefit, similar to SSDI, but the difference is the cash benefit is based off the parent's work record rather than the adult child. So in order for an individual to be eligible for the CDB benefit, they have to meet the same definition of disability, but they have to have been found disabled by Social Security prior to age 22. So they don't currently have to be under age 22, but their date of disability onset had to occur prior to age 22. And then if the parent has insured status, and either the parent is collecting an SSDI benefit themselves, or if the parent is collecting a Social Security retirement benefit, or if the parent is deceased and had insured status, then the adult child can collect off of the parent's work record rather than their own work record. Okay. So you might have an adult child who doesn't have a work history, but then if you're the parent and you retire and start collecting the Social Security retirement benefit, your adult child could start collecting that CDB benefit if their date of disability onset was prior to age 22. Right? And again, there is no asset limit for this benefit either because it is an insurance benefit. So just wanted to ground you in some of the basic rules around the SSDI benefit and that CDB benefit. So what I'd like to do now is to show you a video about some of the SSDI work incentives. The work incentives for the CDB benefit are exactly the same as the SSDI work incentives, okay? So the video we're going to watch, if an individual has SSDI or CDB, or both, these work incentives of this video that we're going to take a look at cover both of them. All right, so let's take a look at this video. All right, so that was a little overview on the SSDI and CDB work incentives. This video is on the Michigan Disability Benefits 101 site. And at the end of this section, there is a link to that video. It's also housed on YouTube. So if you want to take a look at it again, it's available to you. I'm gonna, as we go through some information, I'm gonna pop back and forth between the PowerPoint and DB 101. So I'll show you where all the videos are housed on there as well too. There's a number of different videos on a lot of different concepts. They're all very similar to the one that we just watched. They're about 3 to 5 minutes long, animated, engaging, and provide an overview in plain English to help folks connect with some tough concepts. So just to kind of recap, we want to help individuals create a plan in order to work and get ahead. So the general work rule for working with the SSDI benefit or that CDB benefit is if earnings are below the substantial gainful activity level, and this year that's 1470, unless an individual is blind according to the Social Security definition. There's a higher substantial gainful activity level for individuals who are blind. That's the 2460. So for most folks, the SGA level this year is $1,470. So if gross earnings are below SGA, then the individual is going to receive both their earnings from work and their SSDI payment. If gross earnings are above SGA, or countable earnings, I should correct that, countable earnings are above SGA, then the SSDI benefit would eventually stop. So the video we just watched talked about the 3 phases that a person goes through. So somebody starts out in the trial work period. And the trial work period is just like it sounds. It's an opportunity for an individual to test out working to their best of their ability. They get 9 trial work period months. And it counts as a trial work period month anytime their gross earnings are above $1,050 this month. After the trial work period, then we're looking at the SGA decision, both in that 3-year phase 2 extended period of eligibility and then the post extended period of eligibility. We're looking at the SGA decision. When I'm explaining this to folks, though, depending on what information I have, I usually start out with that general rule, though, that you're seeing on your screen now, that talks about above or below SGA. Because at this point, until I, as a benefit planner, verify what benefits a person is receiving and verify whether they have previously used the trial work period, I don't know that. So until I verify that. So when I'm giving general information, I go with that general rule that generally at some point, even after the trial work period, individuals' earnings below SGA, payment continues, earnings above SGA, the SSDI benefit wouldn't be received. Okay. Again, at the end, we're going to talk about where we can send folks or where you can go to get individualized advisement to see specifically what work incentives have been used in the past, if any, and specifically what phase a person is in when they get that individualized advisement. Okay, so just an example on your screen, if somebody had receiving SSDI of $1,100 and they went to work and started earning $1,200 a month in gross earnings, their earnings would be below SGA and their total monthly income would be $2,300. Okay, so definitely getting ahead of financially. So a lot of times folks are concerned if they move ahead with working, that if their SSDI benefit stops, that they're not going to be able to get it back, that they're going to have to go through reapplying all over again for the SSDI benefit or the CDB benefit. We know from that video, there's 2 provisions that allow people to quickly restart their benefit without having to reapply. So when folks are in that 3-year extended period of eligibility or phase 2, I always kind of liken it to you're on payroll and you can't be kicked off of payroll during that 2-year period. It's just whether or not you're entitled to your SSDI payment or CDB payment based on your level of earnings. So if you found a job and you were earning $3,000 a month and you were okay with your SSDI payment pausing, you're still protected during that 3-year window, because if you have to stop working or your earnings drop below SGA again, your payment's going to start right back up because your claim didn't close. The case wasn't terminated. It's still open. It's available for you if you need it. The third phase, the post-extended period of eligibility, is the first opportunity that the SSDI benefit could be terminated due to earnings from work. But if folks choose to go down that route and actually have their benefits terminate because they're earning enough above SGA and they're okay with that, they still get a 5-year window to apply for expedited reinstatement, which is different than a new application. So expedited reinstatement, you're given 5 years from the date of termination to apply for expedited reinstatement if your earnings drop below SGA. While Social Security is making a decision to see if you're eligible for expedited reinstatement, they're paying provisional benefits, up to 6 months worth of provisional benefits. And then if the person is found eligible, payments would continue. If the person was found not eligible for expedited reinstatement, they wouldn't have to pay any benefits back that they received while Social Security was making that decision. And it's looking to see, it's not looking, what they're looking for during the expedited reinstatement decision is, did the person medically improve? So when their benefits were terminated, it was terminated because of work, not because Social Security said the person had medically improved. Okay, and there's a difference there. So benefits were terminated due to work, and therefore Social Security's looking during expedited reinstatement, was there medical improvement? Is there a question, or does somebody accidentally?
Co-founder of the SSI Institute for Black Dance and Culture.
Thank you.
I went ahead and muted everyone.
Thank you.
Oh, wow. So it began with a group of friends that came together.
Somehow my screen got mixed up, so one moment, let me fix that again. Okay. Okay. So expedited reinstatement is a way for folks to be able to quickly restart the SSDI or CDB benefit again. And then,
well, that is almost like.
Thank you, Sally. All right, sorry about that. So, and the other thing the video talked about is Medicare. So Medicare is going to stay in place as is, basically at least 7 years, 9 months from the trial work period. And then there's another work incentive that allows individuals to continue Medicare coverage if they still need it beyond that, another work incentive. So the health insurance Medicare isn't going away at all.
Tracy, I'm not seeing anyone unmuted, but I am getting feedback. So if everyone on the presentation could mute themselves.
But then when you increase that pace, or you go up a hill, you use.
Okay, that seemed to stop it.
Okay, thank you. Sorry, I wasn't seeing that.
Yeah, she was muted, but I just did the disabled mic thing because for some reason it was still coming through. So Josie, if you want to speak, just raise your hand and we'll be able to unmute you. Okay. All right. So Medicare is going to stay in place as well too. Some of the resources available on the Michigan Disability Benefits 101 site. Actually, let me just go ahead and take you over there and do a little overview of it on the DB 101 stuff. So this is the Michigan Disability Benefits 101 site. It's just mi for Michigan.db101.org. immediately reinforces that you're in the right place to see how work and benefits go together. One of the tools that is really helpful is this benefit and work estimator. An individual is able to put in all of the benefits that they receive, so which Social Security benefits they're receiving, maybe they're getting food assistance benefits, maybe they're receiving a housing subsidy, can put all that in here. It actually includes veterans benefits now too. And then they're able to put in a work plan, so how much they would like to work and earn. And then it'll give a financial outlook on what that work plan would look like and show what changes, if any, would happen to their benefits. And it provides a timeline overview of if there's going to be any changes down the road. So if a person hadn't used their trial work period, it would show if they are projecting to use them and when they would move through that. It would show the 3-year window. So it's a really robust tool to help folks connect with all of that information. I'm going to keep scrolling down to the bottom of the page. On the bottom of the page are the videos that I referenced. So we just looked at the SSDI work incentives video, this one right here. But as you can see, there's a lot of different videos on a lot of different topics here. So I'd recommend that you take a look at these. And there is a video on that benefits and work estimator. So this video would actually provide you with an overview of how to use that benefit and work estimator tool. Okay. So some additional SSDI resources. How the site is, the navigation of it is primarily through these tabs that I highlighted at the top of the page. So we're currently on the home page. The work and benefits tab has articles, kind of high level articles on where to get some help related to working, how work and benefits go together, that type of thing. The programs tab has articles on specific benefit types. And the MyDB 101 allows individuals to have additional activities there, to use the Vault feature, which there's a video on, and to save these estimators if they use any of them, and to save favorite articles and tools. So we want to show you some more SSDI resources. So I clicked on the Programs tab and scroll down a little bit, and we see we have an article on Social Security disability insurance. So if I go into that, all of the articles are set up the same way. So over here on the left-hand side of the screen, we see this article, or the table of contents over here. So this is everything that's included in the article. But if I go to the page on SSDI and work, this is going to be a written version of, and in more detail than the video that we just watched. Okay. There's also these try it tools. So this on SSDI, get a quick estimate of how work may affect your income. So these try it tools are like little mini tools that help people understand a concept. So if I clicked on this try it tool right here, it's going to pop up a new window, and we can do a short scenario of what it would look like for a person if they went to work and what would happen to their benefits. So these little try it tools are embedded within the article to help connect with some of the concepts that they're talked about. Okay. And then if there's any other videos that correspond with these, you're going to see those within those articles as well too. Okay. So just wanted to point out some of those SSDI resources. Let me go back over to the PowerPoint now. Okay. So these are links specifically to those resources that I just showed you. Okay. So that quick estimator tool, the article, the video, we watched the work incentives video, but there's also a planning for work video and a link to that benefit and work estimator. So you have those within the PowerPoint as well too. Okay. So now I want to talk about freedom to work Medicaid, because this generally corresponds to individuals who are an SSDI and SSI. So, or sorry, SSDI and CDB. So we know that the SSDI benefit and the CDB benefit come with Medicare. So Medicare automatically comes with it. it does not automatically come with Medicaid. In order to see if a person is eligible for Medicaid, they would just have to apply through DHHS. It's not automatic. So a lot of folks are on SSDI or CDB receiving Medicare and also receiving Medicaid, and concerned that Medicaid is not going to stay in place if they go to work, that they're going to go over income limits and they're going to lose that Medicaid insurance. Freedom to work is it's a Medicaid buy-in category. It's the Michigan specific version of this that allows individuals to maintain Medicaid coverage while working, or obtain Medicaid coverage in some cases if they didn't previously have it, if they were over income limits. So freedom to work Medicaid is a powerful work incentive. In order to be eligible for it, you have to apply through DHHS. They will assess the eligibility for it, but you have to be disabled according to the Social Security definition, to be between the ages of 16 and 64. You have to be working in some capacity. And there's an initial eligibility criteria and then an ongoing eligibility criteria. So the initial eligibility criteria is that a person's total countable income has to be under 250% of the federal poverty level. And this year, that's that $3,037. And total countable income doesn't include all of a person's income. It includes almost all of their unearned income, which would be their SSDI benefit or CDB benefit, and a little less than half of their earnings. So once you added that up, if it was below that $3,037 this year, then you've met the income eligibility requirement. Okay. The initial asset limit for this program is $9,090. So to initially qualify for it, the initial asset limit is $9,090. Okay. And then the ongoing eligibility, the continuing eligibility. So once you're already enrolled in this, then they're just looking at, is your countable unearned income only below 250%. So that basically means that once you're on Freedom to Work Medicaid, there's no limit on your earnings, as long as your unearned income stays below 250% of the federal poverty level. Examples of unearned income, again, are SSDI, CDB, if a person was receiving spousal support, unemployment, a pension, those would be examples of unearned income. Okay? But no limit on earnings once you're on it. And then the asset limit also goes up to $75,000 once you're on this, on Freedom to Work Medicaid. Okay, so people can actually save money on this Medicaid program. And any funds that they contribute to an IRS approved retirement account while they're on Freedom to Work Medicaid and working, there is that those are not counted as assets. Okay. So if anybody is on like a Medicaid spend down right now, which means that DHHS says they're eligible for Medicaid in every other way except their income is too high, if they started working, they likely could fit into this Freedom to Work Medicaid category and get rid of that spend down and have full Medicaid benefits. There may be a premium for Freedom to Work Medicaid. It's based off of a person's total income, no deductions. So if their total income is below 138% of the federal poverty guidelines, which is about $1,676 this year, they would not have a monthly premium for it. If their total income was between 138% and up to $75,000 a year, then their premium would be at 2.5% of their gross monthly income. So just put an example up there to help you connect with the affordability of it. If somebody had $1,400 in SSDI plus $1,000 in earnings, that would be $2,400 total income per month. Times that by that 2.5%. So they would have to pay basically $60 a month to keep Medicaid in place, which is a phenomenal avenue. If somebody had income above $75,000 a year, then the premium is based off of the average cost of care for everybody who's currently on that program. So I don't know that we have anybody in that category above $75,000 a year. But to apply for that, if the person is not already receiving Medicaid, they can do an application at the local DHHS office, apply by phone, or go to My Bridges. If a person is currently on a Medicaid category and starts working, they just need to report that to DHHS, and then their category would change to Freedom to Work Medicaid. Okay, so really, really powerful work incentive. And then let me show you just a couple resources on DB 101 too in relation to that. All right, so we're back to DB 101. I'm going to go back to the home page and look at these benefit planning estimators. So there is a Freedom to Work estimator. This will do all the math for you. So you can put in how much you're receiving in benefits, how much you are currently earning per month, or how much you'd like to earn per month, and it'll do the math to see if you're eligible and give you an estimate of how much the monthly premium would be. So great resource to connect with that information. And then I'm going to go back to the programs tab, and there is an article on Freedom to Work Medicaid that goes into all of the details that we just covered and a whole lot more about the Freedom to Work Medicaid. Some more information on DB 101 and what you need to do to apply as well. And Sally, feel free to interrupt me at any time if folks have questions that I haven't seen.
Nothing in the chat so far.
All right.
What about Michigan Works for seniors? Have you heard about that?
No, we're primarily covering the Social Security disability benefits today. So most folks who are receiving benefits based off of age, those would not be a disability benefit. But I can show you, I'm not sure if we have Michigan Works information on DB 101. Next time I pop over there, I'll take a look and see if we've got some information for you on DB 101 for that.
Oh, okay.
Any other questions? You can feel free to unmute yourself if you do. All right, so let's jump into SSI and Medicaid. So again, SSI stands for Supplemental Security Income. This is the cash benefit that's based off of meeting the financial needs-based eligibility for it, okay? So this one is not based off of a person's work record. It's based off of meeting the same definition of disability and then having assets and income within the guidelines, okay? The asset limit for an individual is $2,000, and the income limit this year is $914 per month. It's the countable income limit is $914, and countable income doesn't count all of a person's income, okay? It's most of, if they have any unearned income other than their SSI, most all of that would count, and then earnings from work, a little less than half would count for that, okay? That $914 is also the maximum benefit rate that an individual, the maximum amount that an individual can receive this year in that SSI benefit. And then if a person isn't contributing their fair share towards their shelter and food expenses, then the benefit amount could be reduced, because the point behind the SSI benefit is that it's there to help individuals meet their basic shelter, food, and basic needs. Okay, so if an individual maybe is living with a relative and not paying any rent, the amount that they're eligible for an SSI could be reduced by a third. And the SSI is always paid on the first of the month. Again, a way to help you differentiate between SSI and SSDI. Medicaid in Michigan automatically comes with the SSI benefit, and no waiting period for that. So as soon as a person is found eligible for SSI, they become automatically eligible for Medicaid as well too. If an individual is under age 18, then some of their parents' income and assets could count in the eligibility for this benefit. Same if a person is married, some of their spouse's income and assets would be counted in the eligibility for this benefit, because again, it is a needs-based benefit. All right, so let's take a look at another one of these videos from the Michigan Disability Benefits 101 site. This provides us with an overview of SSI and work. All right, so overview on SSI and work. So folks always get financially ahead because of the way the SSI rules are. So when I'm explaining it to individuals, I always say for about every $2 that you earn, your SSI payments reduced by $1. Okay, so there's a couple deductions that they take. There's a $65 deduction that's taken off of a person's earned income, a $20 deduction that's either taken off of their unearned income. If it's not used there, then it's taken off of their earned income, and then you divide in half. So you have an example up on your screen of somebody earning $13.75 per month in gross wages. That would reduce their SSI payment to $344. But overall, they'd be total monthly income would be $15.94 because they're receiving the $13.75 in earnings from work plus the SSI payment. Okay, and I'm going to show you a tool here in just a minute that's going to walk you through that calculation, so you can plug in any number and connect with how that SSI calculation works to figure out how those payments happen. The other thing the video talked about was the 1619B provision. That means if a person has earned so much that it zeroes out the SSI payment, that their SSI claim can stay open and their Medicaid will stay in place if they are still eligible for SSI in every other way except their earnings from work are too high. They're zeroing out the formula. So an individual has to continue to be disabled. The assets still have to be below $2,000. In order to keep Medicaid, they have to need Medicaid, and that's being able to answer yes to one of these three questions, which are either I have used Medicaid once in the last year, or I intend to use Medicaid at least once in the year to come, or I would use Medicaid if there was an emergency medical situation. So if they can answer yes to at least one of those three questions, they've met that need Medicaid standard. Again, basically saying it's their earnings from work that is making them ineligible for an SSI payment. It's not something else that's making them ineligible. And their annual earnings are below the threshold for the year. And this year in Michigan, it's $42,027. So individuals can maintain their SSI claim. The claim stays open, it doesn't close, and maintain their Medicaid. So somebody could be earning $3,000 a month, still have Medicaid, and maybe doing that for 3 years, and something happens and they're not able to sustain it, and they stop working or their income drops to the point that they're eligible for an SSI payment. That SSI payment would start back up. It does take 2 months for that payment to go back up to the full amount just because of the way that the Social Security manages the payments, but they wouldn't have to reapply all over again because their claim never closed. It's just sitting there in the background waiting for them. So I want to take you back over to DB 101 again, and I want to show you that SSI calculation tool that will do the math for you. There we go. All right. So we should be seeing the DB 101 tool. So I'm going to go back to the Programs tab, and I'm going to find the article on SSI. And we see that there's an article on SSI and work. And then there's how SSI counts your income. So those little mini tools, whenever you see a page in the table of the contents that shows the little hammer and wrench tool, means that there's one of those little mini tools on it. So let's go to the how SSI counts your income. And we see that there's a mini tool or try it tool on this page called your SSI benefit calculation. So I want to walk you through this to help you understand how the SSI calculation works. Let me make that a little bit bigger for you. Oops. Let's try this again. All right. So step one is determining the countable portion of a person's unearned income, not including their SSI. Okay. So if the person was receiving SSDI, spousal support, unemployment, we would put that number in this first box. Let's just go through our first scenario where the person does not have any unearned income. Okay. So then we're going to go down to step number 2, which is determining the countable portion of earned income. So let's say somebody wanted to make $1,500 a month. Okay, so I'm going to pop that in, the monthly earned income. Because we didn't use that $20 deduction in step 1, this calculator automatically brought it down here for us. And then the $65 deduction gets taken off there too. It's the earned income exclusion. So take the 1,500, subtract the 20, subtract the 65, and we're at the 1,415. And then we divide by 2. So this is where the 2 for 1 comes in. So for about every $2 that you earn, the SSI payment's reduced by $1, okay? So the countable portion is $707.50, okay? Step 3 is just adding up the total countable income. So if the person would have had any unearned income, the countable portion would have been brought down here. But we didn't have any in this scenario. It brought down the countable portion of the earned income, the $707.50, and so we're still at $707.50. And then our last step determines the SSI payment amount. So the maximum benefit this year is the $914. Sorry, my screen keeps scrolling. And then you subtract the total countable income, that's $707.50. So in this scenario, the SSI benefit would be reduced to $206.50. But the total monthly income is $1,706.50 because the person has $1,500 in earnings from work plus the SSI payment of $206.50. Okay, so definitely getting ahead by going to work. So this is a really quick way to pop in any number that you want. You can pop in $925 and scroll to the bottom. Okay, that would make the SSI payment $494, total monthly income $1,419. Okay, so a quick way to show you how to how that formula works and to show what would happen to the not only the SSI payment, what the total monthly income picture would look like for folks. In addition to that tool, there's the SSI and work article. So this goes into more detail than the video that we just watched about the work incentives available. And there's also an additional try it tool to give you just set up a little bit differently than the one that we just looked at to give you a quick estimate of how the SSI payment would be affected and what the overall financial picture looks like. And then I'm going to go back to the main page. This benefit work estimator, I know we talked about this in the SSDI section, but here is all of, you can also use this for SSI. So this is all of the benefit programs that can be covered in this estimator. So it covers SSI, it covers the state SSI payment, SSDI, DAC or CDB benefit, food assistance, Medicaid, Medicare, veterans benefits. So it's pretty comprehensive, all the benefits that are covered. So if an individual's on SSI, they can certainly use this tool as well too. And then back to the home page, I'm going to scroll down to the bottom and just point out the video that we watched. So we watched this SSI and work video. There's also a video about SSI and youth who work. So this would apply to kind of transition age youth and young adults, some special work incentives that are available to them. There's a video on how to report wages for SSI. It's very important for individuals who are receiving SSI that they report every month their wages when they're working for SSI because of that calculation that we just looked at. If a person isn't reporting, then Social Security could be underpaying or overpaying the individual if they're not reporting their actual wages on a monthly basis. I think that's all the SSI videos there. I also, while we're in this section, wanted to point out a couple resources for that are specifically for our youth and young adults. So there's an article, I'm on the main page about 3/4 of the way down. There's an article about what benefits support our youth and young adults in working. There's an article on how benefits support work with a parent focus as well too. And there's also the school and work estimator tool. This applies to individuals who are receiving SSI and under age 22 and a special work incentive called this student earned income exclusion. So this school and work estimator will show how that work incentive, this student earned income exclusion works. And that's actually a really cool work incentive because that formula that I just showed you, that calculator I just showed you, that wouldn't apply when individuals are under age 22 working and going to school. Basically, their SSI payment would not be reduced. So this would show you how that works. There's also that video that gets into it to the SSI youth who work. So this video would show you more about that student earned income exclusion as well too. And there is also within the SSI article references to there's a try it tool for that student earned income exclusion, and this is the narrative of the student earned income exclusion that helps you understand how if you are a young adult or have a young adult you're working with or parent or family member of, this would give you the explanation on that specialized work incentive as well. And then there was a question about Michigan Works. So I want to just show you where there's some additional resources on this site as well too. So on every page on the DB 101 site is this blue circle with the question mark on it. This is the Find Help menu. So if I click on that, and I'm going to scroll down to work preparation, and if I expand that, these are programs, Michigan Rehabilitation Services, BSBP, and Michigan Works. This actually links you to the Michigan Works site for getting help with returning to work as well too. So there is a link to Michigan Works on there. And within the work and benefits tab, there's an article called Programs That Support Work, where there's a section on Michigan Works too, and it talks about the services that Michigan Works can provide in here as well too. Okay. All right. So the other thing, let me go back over to the PowerPoint. There we are. So we talked about that 1619B provision last before I showed you where some resources were on the Michigan Disability Benefits 101 site. The biggest issue for individuals when they're in the 1619B status is they understand they can get financially ahead and okay with the SSI payment stopping because they're getting way ahead financially, Medicaid staying in place, but oftentimes this assets keeping assets below $2,000 can become a problem. So I want to talk a little bit about ABLE accounts. So moving on, these are the resources on SSI and work I just showed you. These are the resources on SSI and young people who work that I showed you on DB 101. So you have those direct links. And now let's jump into ABLE accounts. So ABLE stands for Achieving a Better Life Experience. And they're basically an account that lets individuals who are disabled according to the Social Security definition be able to save money and not have it affect their public benefits. So for SSI purposes, the first $100,000 in an ABLE account does not count as an asset for SSI. Okay, so if you had somebody who was or you are somebody who's working and in that 1619B status and trying to figure out how to keep your assets below $2,000, this is a way to put money into an ABLE account and not have it count towards that $2,000. For other public benefits that have an asset limit, almost all of them are excluded. Any funds in an ABLE account are excluded towards those asset limits. So Medicaid, food assistance, programs that help pay for Medicare costs, any funds in an ABLE account are excluded as an asset. So there's no limit for any of the other public benefits with asset limits. The only limit is that SSI, a limit of $100,000. To be eligible for an ABLE account, you have to be disabled, again, according to the Social Security definition, and that disability had to begin prior to age 26. Doesn't mean you have to currently be under age 26. It's just the date of disability onset had to occur before age 26. So that's the only hiccup. But our legislation, in my opinion, did something good at the end of last year. They passed the Able Age Adjustment Act, which increases the age of disability onset from 26 to 46. So starting on January 1st of 2026, got a few years to wait for it to go into effect. ABLE accounts will then be open to anyone who had their disability begin prior to their 46th birthday. So this is going to open it up to so many more people because of that age increase. Again, that does not go into place until 2026. Right now, until then, it's prior to the 26th birthday, but beginning 2026, it'll be prior to the 46th birthday. Okay. There are limits on how much you can contribute per year. So this year, the limit is $30,590. 17,000 of that can be from any source. And then if a person is working, they can contribute up to the 13,590 from earnings. Okay. And it is a tax exempt account. And then the funds in an ABLE account can be spent on any qualified disability expense. And it's basically anything that can improve the quality of life of the individual. So it's a pretty broad definition. So it can be used on medical care, transportation, housing, obtaining, a person's basic needs. So if they need a new bed, if they need clothing, if they need shoes, if they need kitchen supplies, that's going to improve, a person's quality of life. So those would all count as qualified disability expenses. The only limitations when the representative from Michigan's ABLE account, when I attended a presentation, limitations were not gambling, can't use it for gambling, can't use it for adult entertainment, can't use it for legal or illegal for that matter, drugs or alcohol. But other than that, everything else could be considered a qualified disability expense. So there's not a lot of restrictions on how those funds can be used once they're deposited into an ABLE account. Here's the resources, and I'm going to actually show you where to find these once again on DB 101. All right. So if I go to the programs tab once again, I lied, it's in the work and benefits tab. Okay, there's our article on ABLE accounts. I click on that. We see over here in the table of contents, this is going to go over the qualifications. This is how to open it. here's more on the rules for spending, rules for making deposits, and then there is links to, this takes you to the National Able Resource Center, so a whole lot more information there. And then there's a link right here to Michigan's Able account. So you don't have to, a person can only have one Able account. It doesn't have to be the Able account of the state that they reside in. You could, if Connecticut has an Able account, you could live in Michigan and open an account through Connecticut's Able account, but you can only have one. Most people open an account from the state that they live in because there's an additional tax break in order to do that. So look into it. There's linking here to Michigan's Able account, My Able, and then a link to the National Able Resource Center if you wanted to explore the differences between the Able accounts that different states offer. You could get that information through the National Able Resource Center as well. Additionally, there are other funds. There is other accounts that do not count as an asset. So mainly the Special Needs Trust. These are all within this Building Your Assets and Wealth article. So this talks about, the importance of saving money, but then it goes through Able accounts. It goes through the Special Needs Trusts. Special Needs Trust primarily, I see when family members want to set up, have a larger sum of money that they want to set up a trust for an individual. So these would not count against assets limits for public benefits either. But generally, I see folks using those special needs trusts when there's a larger sum of money. If it's a smaller sum of money, typically I see folks using Able accounts to manage that. The special needs trusts tend to have more fees associated with it, and they need a attorney or money manager to manage those trusts as well too. So they are a little bit more comprehensive, but there is I just wanted to point that out because there is additional information on here, as well as some additional, this plan to achieve self-support is a specific work incentive that allows individuals who are SSI eligible to set aside money to go towards a work or employment goal and not have it affect their SSI payment. So that's another powerful work incentive there. So I just wanted to point that one out to you. And let's go back to the PowerPoint one more time. Sally, is there any questions? Or if anybody has any question, you can feel free to unmute yourself. I know I'm covering lots of information.
Nothing in the chat now.
All right. So last thing I wanted to talk about was so this is a really broad overview and it's a ton of information. So I want to talk about ways that you can get additional help. So clearly the Michigan Disability Benefits 101 site is a wealth of information and resources on how benefits and work go together, on getting additional support for work. There's articles on veterans benefits as well too, so a ton of information there. But then I also wanted to talk about where folks can go to get individualized benefit coaching or benefit counseling. So in Michigan, mentioned earlier, we started the Benefit to Work Coach model about 4 or 5 years ago now, because we found that there was a capacity issue with individuals being able to obtain the benefits, individualized benefit counseling that they needed in a timely manner and as an ongoing support role. So the funding for the Benefit to Work Coach model is, again, through the Behavioral and Physical Health and Aging Services Division of MDHHS. And is supported through SAMHSA funds, so primarily focusing on individuals who are experiencing a mental illness. So a lot of our community mental health agencies across the state of Michigan have a benefit to work coach on staff. Some agencies also have a benefit planner on staff. So what a benefit to work coach is, it's a certification process in order to hold themselves out as a benefit to work coach. And they are able to answer and address more straightforward, more automatic work incentives, which 90% of the time our benefit to work coaches are able to address those questions that individuals have and provide that individualized advisement. So our benefit to work coaches have to go through quite a bit of training in order to be certified. They have to go through some online learning modules, and then they attend a live 2-day training to start to solidify those concepts, and then figure out how to deliver the service. And like I said early on, kind of help be that interpreter, help figure out how to explain this to the individuals that they're going to be working with to help them connect with this information. And our benefit to work coaches, again, it's an ongoing service. So generally, they meet with individuals and collect information they need in order to provide the individualized advisement. And then they give them a big picture, overview based on what the person is thinking that they would like to earn on a regular basis. And then they do follow along supports, meaning when an individual maybe changes jobs, maybe if they get a raise, if they get a request from Social Security to submit information related to work, or if they get a letter from DHHS related to requesting information related to work. Our benefit to work coaches are able to provide that ongoing individualized supportive information. So we have about 36 benefit to work coaches across the state of Michigan at this point. I know we're primarily focused here in Oakland County. So our core providers in Oakland County, CNS, TTI, and Easter Seals all have a benefit to work coach. Actually, all of them have 2 except CNS. CNS only has 1, but they all have a benefit to work coach on staff. So if you are receiving services from one of those providers, or you're working for one of them, or have a family member who's receiving services through one of them, they can request to be connected with that benefit to work coach. At TTI and CNS, the benefit to work coaches are within the employment program. At Easter Seals, they are not connected. They help with the employment program and provide that advisement, but they also help with general benefits help as well too. So best way is to ask, if you're receiving services, or if the individual is receiving services, to ask the case manager or sports coordinator for that service to get them connected with that. If not, through our vocational rehabilitation services in Michigan, so Michigan Rehabilitation Services and BSBP, they also provide benefit planning services. The individual just needs to request those, and they will be paid for through them. And then for individuals who don't fall into any of those categories prior to that, I would recommend, like the video said, to contact the Ticket to Work helpline. Ticket to Work helpline, the individuals who answer that have received work incentive training, and they're also able to look up what Social Security benefits the individual is receiving. So they're going to be able to provide them with some general advisement over the phone. And then they're going to offer to connect them to the Social Security funded Work Incentive Planning and Assistance Program, or WIPA program, who are the benefit counselors. Benefits counselors, again, have received 1 of 2 national certifications, and are able to handle the more straightforward automatic work incentives and complex issues as well too. Forgot to mention, within our benefit to work coach model, we have a benefit planner within our model. So when our coaches are dealing with something that's maybe a specialized work incentive or a complex issue, they have access to a benefit planner to help resolve that. So back over to DB 101 one more time, at least. And this big blue circle with a question mark on it again. So if I go to the how work affects SSI and SSDI, we see we have the Ticket to Work helpline number right there, but we also have contact a benefits planner. If I click on that, it's going to take me to the page that shows what agencies in Michigan have the contract to provide that work incentive planning and assistance program. So in Oakland County, that is coordinated through the ARC Michigan. And you can contact them directly. However, I would recommend going through the Ticket to Work helpline because then the individual is going to be getting some information to go on while they're waiting for the referral to get connected to the benefit planner through one of these 3 agencies. And then the benefit planner has to verify and collect information before they're able to give individualized advisement. So by going through the Ticket to Work helpline, folks are getting some information to go off of while they're waiting to get connected with a planner. But wanted to point that out based off of county, the 3 agencies in Michigan. Other thing I wanted to point out on this find help menu right at the top is ask a Michigan benefit to work coach your question. So there's an opportunity, if you click on that, it'll pop up this window where you can send a message to a benefit to work coach. Please don't put any personally identifiable information in there. And then a benefit to work coach will get back with you within 2 business days. If it's something that is beyond what can be handled in a email exchange back and forth. Sometimes it's a quick question and it can be, but if it's something that's more involved, then that benefit to work coach is going to offer to meet with you via phone or a video platform like this to address your specific questions and concerns on that as well too. So that's another avenue to access a benefit to work coach. And then additional resources on a whole lot of other variety of topics are all within here as you expand each of those sections. It'll give you more information on resources to help with that. Any questions on any of this? Anything we've covered so far or things that we haven't? All right, there is, so this is the slide that we just looked at. This is a direct link to that, those WIPA programs. And then some additional resources. Of course, we have the Michigan Disability Benefits site, but a link to Social Security, a link to the My Social Security account, that My Social Security account for individuals who are receiving benefits. If a benefit verification letter is needed, they can get that there. If they're working, they can also report their earnings to their My Social Security account. This is a link to the Social Security Red Book, which is their guide to work incentives. So for more information on work incentives, this is the Social Security work site that will link you to additional information resources. They do webinars from time to time, but then also a lookup for not only what are the vocational rehabilitation agencies in each state, but also employment network providers in your area. So you can search for those as well too. And then a link for My Bridges for the DHHS benefits like Medicaid and food assistance benefits. For folks who need to apply for those benefits or report changes to those benefits. You have all of those as well too. And that's all I have. And you have my contact information there. If there's anything that I can do to assist you with getting the information you need or connecting individuals to resources, please let me know. And I'm certainly willing to hang out and answer any specific questions that you have and point out some additional resources. So please make use of this time.
Yes, there's a program with Michigan Works that's for 55 and up. And it's supposed to work with your Social Security and your disability and your Medicaid. Do you know anything about that?
I am not familiar with that. Let's actually let me go to this article.
It's a well-kept secret.
I would like to know about that secret. Let's go to the Michigan Works website here.
They said you can only make like $900. It's like community service, but you get paid for it.
Huh. Is there a specific name for it?
1 second. It's called the Individual Employment Plan. Senior Community Service Employment Program, SCSEP.
Senior, could you say that again? The Senior
Community Service Employment Program.
I will look into that.
Oh, okay, that'll be something good to discuss for the seniors.
Absolutely, because generally disability benefits end anywhere between early retirement age 62 up to full retirement age 67 and a few months. But if that other program starts at age 55, there definitely is an overlap between this. So I will dig a little deeper and look into that one. I'm not familiar with that one. Yeah, thank you for bringing that to my attention.
Okay, thank you. Have a nice day. You did a wonderful job.
Thank you.
No questions in the chat, just some comments from Amanda and Teresa just saying thank you and that this was great information.
Great. Yeah. And Sally, were you doing an evaluation with this one that you were going to email out, or?
No, there's no evaluation.
Okay.
And it looks like Sharon has her hand up.
Okay, go ahead.
Sharon, if you want to unmute.
There you go.
I got a quick question on SSI. For qualifications for SSI, is that totally based on income?
Yeah, income and asset limit. So the countable income limit is for an individual is $914, and the asset limit for an individual is $2,000. And you have to meet the definition of disability too, but then be within those.
So the 914 is the income, earned income, I take it. Has to be below the 914 level.
Yeah, so I can.
Okay, that helps me.
This tool that I showed earlier in the SSI article.
I see it. It was right there. I just saw it. Yeah.
Yep.
914. Okay.
Yeah, so this actually does the countable income formula for you. So if this number, if the person had maybe they were getting like an SSDI benefit of $500, this would show that the countable income is $480.
Does the SSDI count towards that?
Yeah, if the person was receiving SSDI, that would. But this does the math to see what the total countable income would be for you to meet that. See if you're below the 914. So unearned income goes in step 1, earned income goes in step 2, if any, and then assets below 2,000.
Great. Thank you. Good
You're
job.
welcome. Thank you. All right. there's not any other questions, I appreciate all of you attending this evening. And again, if you have my contact information, if there's anything that I can do to help you on your quest to continue to get the information you need, feel free to reach out to me. Enjoy your evening.
Thanks so much, Tracy.
Thanks, Sally. Bye, everybody.